So today I'm going to be adding a new video to our series, Did You Know? If you didn't watch the last one, I'll link it above. We talked about billed amounts and allowed amounts. But today we're going to be talking about co-payments and co-insurances. Now, if you have been in billing anytime, you could have even gotten into it yesterday. I'm pretty sure that you have already heard about co-payments and co-insurances. And even if you're not in billing and you're just a patient, or maybe you've dealt with patients and went to the doctor with a patient, then you've probably heard of co-payments and co-insurances. So remember, the purpose of this series is to just help you understand concepts and terms in medical billing that maybe you just didn't know about at all, or maybe you need to get more clarification, you don't really understand it, and I'm hoping that I can help clarify some of the things you don't understand in these videos. So if you're interested in hearing more about copays and co-insurances, then please keep watching. So first we're going to start off with the definition. A copayment is a fixed amount that the patient pays for a covered healthcare service or treatment. And a coinsurance is a percentage that the patient pays for a covered healthcare service or treatment. So the difference between the two is that a copay is a fixed amount and a coinsurance is a percentage. So just so you know, the real words for it is copayment, like I said, but you most likely will see copay, C-O-P-A-Y, and then it's coinsurance, but you most likely might see co-in with an S, and that is C-O-I-N-S. So in medical billing, we like to cut words short, use acronyms, all of those things. So just remember that if you see this written, this is what they mean. Now, both of these terms are considered cost share for the patient. And cost share meaning that the patient and the insurance company are sharing the cost of the services that are being provided. So it's not all on the insurance company and it's not all on the patient. So how are these two terms used in medical billing? Well, as for medical billers, we use these terms all the time, and they're important to us because we can then determine how much the insurance is going to pay along with the fee schedule. We can determine how much the insurance is going to pay and how much the patient needs to pay. Now, that is important to us because we want to make sure that when we get the payment from the insurance company, it is the correct amount. Now, I know you might be thinking, well, whatever the insurance pays might be the correct amount. We just go with what they say, and they're the ones who hold the policy information. But sometimes they get this wrong. So trust me, they do get this wrong sometimes. So if the patient has a policy and they're only supposed to pay a copay, sometimes the insurance will take out a coinsurance. And they're not supposed to. And you as the medical biller are supposed to then call the insurance company and have that corrected. Now, I've said this several times before on my channel. I am also a patient advocate. So I look to see that the patient is also being charged correctly. Like, I just don't take what the insurance company says. If I know that a patient's insurance is supposed to cover 100%, or if the patient only has a copay and now they're being charged a coinsurance, I'm going to ask questions. I'm going to see if was something changed, if the patient changed their policy, if it was for a specific service that they had it for. I'm going to look deeper. So as for me, being a medical biller, I also make sure that the patient is being charged correctly, and knowing what the coinsurance and copays are helps me to determine what the insurance is supposed to pay. So if you're new to billing, or if you want to start a medical billing business, be sure to schedule a remote one-on-one with me. I have 45 minutes and 90 minutes remote one-on-one calls where you can ask me specific questions about medical billing or starting a medical billing business. Remember, I am not teaching you on this call anything about medical billing. It's more about your career and what schools you may want to go to, or even if you want to start a medical billing business. So be sure to schedule your remote one-on-one today. Now, how do these terms relate to each other? These terms relate to each other because for the most part, most policies or some policies have both copays and coinsurances. Now, patients do get these terms confused. They are pretty close when it comes to the co part of it, right? So they get them kind of confused. So They may notice that they have just been paying a copay, paying $30 here, $30 there, and then one time they see that they have to pay more, and they're wondering why. But that may be because in this situation that they're in currently, they didn't have a coinsurance and not a copay. So then you have to explain to them what a coinsurance is, what a copay is, and help them to understand the difference between the two. They are also related depending on the premium. So for the most part, when a patient pays a high premium, their copays or their coinsurances tend to be pretty low. Now, this is just a generalized statement, so don't quote me on it. But from what I've noticed, if a patient pays high premiums, then they usually have good benefits, low coinsurances and low copays. But if a patient has a lower premium or really low premiums, then their copays and their coinsurances are really high, or their cost share are really high. But it just all depends on what the patient's needs are and what they're going to use their insurance for. That will help them determine what type of insurance they should get and how much they should pay for that insurance. So we're going to jump into 3 examples of copay and coinsurance. The first example is going to be of one that just uses copays. So let's say that a patient comes in for an office visit and they are billed a 99203. The 99203 is $150 and the patient's copay is $30. But they also have a procedure done on that day, and let's say the procedure also applies to the copay. Now, sometimes that's why you need to check eligibility and check the policy. Sometimes when a patient has a policy that only has a copay, that copay will cover whatever the patient has for that particular day. So the patient may have had a visit, they may have had a procedure, they may have had a laboratory done, all in the same office, and they only have to pay one fixed amount. That's kind of rare now, like I said, but it can happen. They can just have a copay and all of the services are covered. So if the visit is $150, like I said, and the procedure, let's say, is $200, that's $350, but the patient only has to pay their $30 copay. Then we're going to talk about coinsurances only. So let's say that same situation, but the patient doesn't have a copay, they have a coinsurance. And their coinsurance, let's say, is 10%. So it's 10% of the total charges. So again, if the patient had a visit, 99203, that's $150. And then the procedure is $200, that's $350, and 10% of $350 is $35. So you see how that works when it comes to coinsurance and copay. And that's if the policy only has coinsurance and copay. But then we're going to go into if the policy has a combination of the two. So they have both a copay and a coinsurance. So we're going to use the same scenario, but this time the office visits go towards the copay and the procedures go towards the coinsurance. So if that's the case, then the patient would pay $30, let's say was their copay for the office visit, and then they would pay, let's say, 10% of the procedure, which is $200, so that's $20. So then their total payment would be the $30 plus the $20, which is $50. So as you can see in each example, the patient pays different amounts. The first example, the patient paid $30. The second example, the patient paid $35. And the third example, the patient paid $50. So there can be a combination. There can be just one or the other. But that's why it's important for you to check the patient's eligibility. And if you don't know how to do that, watch this video that I'll link above. You need to make sure you check the patient's policy, you verify coverage and eligibility, and you make sure that you know as the medical biller what they need to pay and what their coverage is. Now let's jump into the myths. And the first myth is that every policy has a copay and a coinsurance. Now that is a myth because not every policy has a copay or a coinsurance. Like I mentioned earlier, If you have a high premium or if you pay a lot for your insurance, for the most part, you will have good coverage, meaning that your insurance may pay everything, may pay 100% of all of your services, meaning that you don't have any cost share, which means that you don't have any coinsurance or copay. So again, you have to check the patient's policy to see what the patient has. The second myth is that policies don't have both a copay and a coinsurance. Now, that is a myth because for the most part, most policies nowadays that I see have both copays and coinsurances. And it is not rare that a policy can have that. Now, certain policies will put certain services under the copay and certain services under coinsurance. Now, when you're doing the verification and eligibility, then you should be able to check and see which services fall under copay and which services fall under coinsurance. Now, there could be a time when a patient comes in for a service or come in on a date of service and both of those things apply, just like I stated in the example, and we had to separate the services and use the copay for one and then use the coinsurance for the next. And then there's the myth that patients believe that because they pay a premium that they don't have to pay their copay and coinsurance. Now, I know as a biller, you have probably heard a patient say that, and I hope you have explained to them that just because you pay your premium doesn't mean that you don't have an out-of-pocket or a co-share that you have to pay as well. So you need to look at your policy, which is what I would tell them, and see what your copay or your co-insurance is. Now, if you like this video, then you'll love this video. And I'll see you again in my next one.